Welcome to Our Scars Speak. My name is Christina Miner. I am the host of this podcast. And before we begin, we want to give a disclaimer that we're just merely here to share our stories and to provide encouragement. And that is all. We do not recommend anyone to use anything that we are saying. Definitely make for sure that you listen to your own health professionals, whether it's medical, mental health, or what have you. We are not being held liable for anything that's discussed here tonight. And without further ado, today we have Jaclyn, and I met Jaclyn on Instagram. I'm pretty sure it was Instagram. It was after I had my second surgery because then I was flat and Jaclyn is flat, and she's going to get into her story. And she had a different story. Actually, she was our first Previvor that we've ever had on the podcast. So thank you so much for coming on. I'm so excited about hearing your story.
Thank you for having me.
Absolutely. Yes. So I'm going to let her tell what a Previvor is and everything later on in the discussion. But before we go any further, Jaclyn, who is Jaclyn?
So I am a parent of two adorable but rambunctious little boys, and also two corgis who I love dearly. I am a military spouse, which I like to say to throw out like a niche for folks that are impacted by BRCA1. Because insurance-wise and healthcare-wise, it can be kind of a mess. TRICARE can be complicated. I hear that from every provider that I see, that TRICARE can be complicated.
Yeah, that's what I have too.
And I'm also a university student studying art with a concentration in video games and 3D modeling. And I love to ice skate. I actually have a personal goal of wanting to learn how to play hockey within the next year. And I love to attend hockey games, and it's just one of my favorite sports.
Wow. Just curious, are you originally from up north? You don't have to say what state or whatever, but are you originally from up north?
So I'm from Maryland originally.
Okay. I was just wondering because my husband, he is all about hockey, and he's from Massachusetts, and it seems being up there. So that's why I was like, wait a minute.
Does he like the Bruins?
Oh, absolutely.
Go Bruins.
And that's right. We do have the military part in common too. And I'm thankful that you feel free as we go throughout the interview to share more about that, because you're correct. TRICARE can be interesting. So it's really important to have a good doctor to know how to work those codes and everything else. But, so you are a Previvor, but before you became a Previvor, before you knew you were a Previvor, what was life like? Like, tell us a little bit what was going on that before you even found out about this, not necessarily diagnosis, but about the gene mutation.
Yeah, so I originally so I'm chronically ill, so I'm used to being in and out of doctor's offices. It's not something that I'm unfamiliar with. And I, at one point, as I had told you previously, I thought about getting a breast reduction, and I went through the process of seeing a regular plastic surgeon, and I was dealing with some breast pain. And it was just sort of, it felt off to me. And with my family history of cancer, everybody on my dad's side that's had cancer, I was like, you know what? Cancer has always been in the back of my mind forever since my dad had cancer. And I decided to go get it checked out, be proactive just in case. And I was offered genetic testing at that appointment. So, it sort of just spiraled from there, and now we're here.
So let me ask you a question about back then when you found you were trying to get a breast reduction. So if you don't mind sharing, how old were you when you thought about getting a breast reduction? And then I have another question for you.
I think I was either 28 or, I think I was about 28 when I started that process. And it was going a little bit slow. There was a lot of like pre-op and making sure this is really what you want and all that. And I'm glad that I caught this before I went through a breast reduction, because I would have just had multiple surgeries after that anyway. So it came up at a really good time.
Right. So something that struck me that's very interesting about what you just said prior to that was that your father had cancer, correct?
Mhm.
How old were you when your father had cancer? Do you remember about what age?
Yeah, I believe I was in middle school when that happened.
Now, that is interesting to me because for many of us, when I ask people like, okay, what was life like before you found out you had cancer or whatever they're being interviewed for, they usually, oh, well, life was this, I was out, I was playing with the kids, or I was doing this or that. For you, though, you just said that since literally the age of 8, you had cancer on your mind.
Yeah,
And
it's been a long time.
yeah, so that's different from a lot of people that I interview. It's sort of like we don't have it on our mind until we get it, or it may be kind of like a hit or miss because we've had family members. But for you, especially with your father, I guess that's such a direct, in your face, every day type situation. So you were 8 years old when your father. So truthfully, you're coming up here as really kind of like a caregiver and a previvor tonight, because that part I didn't know so much about. So when your father was going through cancer, did you actually watched him go through
Oh,
cancer?
absolutely. I still remember it all vividly. It was actually pretty traumatic, to be honest.
Right.
My mom, every single appointment, every single surgery, everything, she was there for him. When he came out of, gosh, I think it was something ridiculous, like a 15-hour surgery to remove his tumor.
Mm-hmm.
Um, they were like, "Hey, like, he's never gonna walk. This is really bad." And he was, I don't know if it was a coma, but I just remember him not being conscious.
Mm-hmm.
And I remember showing up every single day with my mom to make sure that he was still there, still kicking, making sure that he was getting up and walking, and he does walk. So it's such a miracle that he still to this day somehow can
Wow.
walk. When they told him, "No, that's not going to happen." So it's just, I remember how terrifying that was for everybody
Right.
at that time, and to see like his own father, my grandfather, who passed away before I was born. He
Mm-hmm.
passed away from cancer, and now looking back through the family history, we're like, oh wow, that had to have been BRCA1
Right.
related.
And so what type of cancer did your father have when he was going?
So oddly enough, his was not anything that I currently know of as a BRCA1 related
Mm-hmm.
type of tumor. It was a large cell
Okay.
mass. And that's what was really confusing to us because he was the person that I got my gene mutation from.
Right.
So when it was something that was just this large mass in his body, it was very different from what you normally hear of
Right.
BRCA1 patients. So it was really odd.
Yeah. This is just an interesting story because that shows everyone, really, truthfully, that this is a very traumatic disease,
Mhm.
even from the standpoint of someone who wasn't going through it physically, but you're watching. And that's why I always talk about having caregivers on, because of the simple fact they have mental scars, just like you just said. It was very traumatizing to you. You still can remember it very vividly. So thank you for sharing that, because I was expecting you to say, oh, I was in school and I was doing this and that. And you were like, no, I was like, I remember my dad. And that is important to hear, because so many people are still trying to figure out whether or not it's associated with trauma. And I'm like, yeah, it's traumatic. It's
Absolutely.
traumatic for everybody around. So you get the gene mutation, and you stated that this particular place that you had gone to actually offers the gene, the test. Is that
Yeah, so the local medical system here is really great with proactive health initiatives, especially for women's health. They
right?
do the genetic testing for anybody that's Jewish or that has a direct, I think, like a parental link to
Mhm.
breast cancer. So when I went to have my check for, I think I had an ultrasound for my breast that had
Okay.
pain. They were like, here's this paper. If you want to do it, that's fine. If you don't, that's also fine. But you qualify if you're Jewish. So here you go. Um, and because I was like, you know what? I would rather know if I have a genetic mutation that I
Right.
can help reduce my risks. Um, and so I signed up and it sounds so gross, but I spit in a tube and
No, that's what.
that's what you do. It's so nasty.
So
But
did so when you did the genetic testing, you said you're Jewish.
mhm.
Can you please share a little bit about why that's so important for individuals who are Jewish to receive that testing? Because I know just like for African Americans, when you're young, we're high risk for triple negative. And so can you
Mhm.
explain a little bit about the Jewish individuals who are Jewish?
Yeah, so the statistic that I found was that about 1 in 10 Jewish women carry a BRCA mutation, and
Mhm.
that is in contrast with 1 in 50, I believe it said, for the general population. So the risk is relatively high.
Wow.
Um, and they definitely recommend that for any honestly any gender of people who are Jewish because it's
Right.
definitely a higher risk familially there.
Wow. And a lot of people don't know that either. Just
Mhm.
so that's why I make a point, like I had discussed with you prior, that if anyone is, anything that's, that other people may not know about, I want you to share about. Whether, like I told you, I had a young lady up here. She said, she's Hispanic, and she definitely shared, about her statistics. And I think it's important that we definitely publicize that. And I don't care, just like I was telling, I don't know if it was you, maybe you or somebody else, but even like transgender, a lot of people overlook the transgender community because it's like, oh, well, they changed their sex, but they still could potentially have a gene mutation. Or I went to this one place where they were talking about basically a woman, her daughter, she became transgender and she did a sex change, and the doctors never offered her again to get her chest checked, or her GYN never said come back. And I was like, y'all, I've got this date on this because I'm very active. It's called P flag, but I'm very active in that community because it's just heartbreaking to see that. And the same thing with different races. So thank you for elaborating on that part. And if you could, can you share a little bit about BRCA1?
Yeah, so I am at higher risk of breast and gynecologic cancers, and there's now they're looking into a link to pancreatic cancer for BRCA1, but I don't think the risk for that is significantly higher um, than any other genetic mutation. Um, and I would say that the percentage depends on which mutation you have. Um, because from my understanding, I was told by my genetic counselor that even within people that have the BRCA1 gene mutation, it could be that your risk is elevated up to 55%, and it could be up to like 70, 80%,
Wow.
because there's different variations of it too. So it's why it's so important to get into your genetic counselor and truly understand your unique individual risk, because
Right.
it's not going to be the same as somebody else with the same genetic mutation.
So what was your level, your percentage? Was it extremely high or?
It was pretty high. I'd have to look at my paperwork again, but I think it was above 65%.
Wow. Okay. So you get this test done, you get the results back. How did that whole process pan out for you? And like, what were you thinking and feeling like when you went through it? I know sometimes they call us on the phone or either they have us to come in. So can you share that process? Because I know for you, of course, you didn't have breast cancer. So your process sounds a little bit different from ours.
Yeah, so it was around I do remember it was around Thanksgiving the
Mhm.
year before I had surgery, and I remember I had to reschedule my appointment, and they said, "Well, I can't do this over the phone." I kept saying, like, can I do it remotely? Is it fine to do it remotely? Like, I'm busy. And they're like, no, like, you really shouldn't do this over the phone. And I was like, okay, that's giving me like some signals here.
Right.
And then I showed up and she was like, yeah, well, you've got a positive marker for BRCA1 and this is what it means. And she was incredible. My genetic counselor is incredible. And she was like, so this is what it means. And here are all the doctors that you're going to need to see now. And I was like, whoa, because it just felt like this tree branch of doctors that just popped up out of nowhere. Like you need to see the um, gynecologic oncologist. You need to see, I would like you to see a breast surgeon. You should talk to this other genetic counselor in case you want to do this. And like there were so many doctors that just cropped up. And it was just such a whirlwind. It went so fast. And I I remember feeling like I was a little bit rushed, but at the same time, I had already made up my mind on
Mm.
what I wanted to do. So I was like, if I can get in that fast, I'm going to do it and just get it over with because the thought of surgery makes me panic. I really don't like surgery.
Right.
So knowing that I would very likely need to have a mastectomy was like, all right, yeah, if we're going to do this, we're going to do it now because if I don't, I'm going to chicken out. And I didn't want to chicken out with
Right.
something like this. It was such a high risk.
Wow. So now that I didn't know either. I didn't know that you have to go see every single doctor. So did you already know before you got the test that you didn't have breast cancer though from the ultrasound that you
Yeah,
had?
thankfully the
Okay.
ultrasound came back clear really quickly. I
Okay.
knew the same day actually because they gave me the results the same day.
I was about to say, because that probably would have startled me even worse. If I hadn't gotten the
Yeah.
results back from that, I would have been like, oh God. Okay. So, and thank you for mentioning about genetic counseling and a counselor, because a lot of people don't know that part either. A lot of people just hear about genetic, but there are specific genetic counselors. Do you know of how people, I guess it depends on the area, would they just ask their primary doctor or their GYN? Who would you think that?
Um, I'm not exactly sure everywhere else because I felt like my situation, it was all like an all in one package.
Mhm.
Um, and when we went to tell the rest of my family, like, hey, you should probably get genetic testing done, I already had a contact for all of them.
Gotcha.
So my whole family just went through the same woman. It was really
Okay.
nice. Um, it's funny, like all the genetic counselors know each other. I think it's a pretty small community
Probably so.
because they gave me a list. They were like, here's all the people that are in Maryland where your family can go. And we know
Oh,
these ladies. They're really nice. And I was like, okay. Um, so I think if you didn't already have a genetic counselor and you don't have one of those preventative health initiatives in a
right.
hospital network near you, you'd probably have to ask a primary care.
Okay. And you're very young at this point. Obviously, you're young
Thank
now,
you.
but at in this story, you're very to make such a huge decision. Um, were you may or I don't think you shared this part. Were you married at this time, or were you okay? You were okay. You
Yep.
were married. That's right. You did
Yeah.
here. Okay. So you were married. And the reason why I asked that is because, as you know, sometimes people, they have a difficult time after surgeries or even during surgeries. And when they find diagnosis, sometimes their loved ones decide, I'm leaving now.
Yeah.
So with that being said, you get this information. Now you have the surgery, or because you said you knew what you wanted.
Yeah, I before I even got my results, I had already discussed with my husband what my choices would be in the
Mhm.
event that it came back positive. And we had talked about it at length. And I said, I had already talked about breast implant illness. I was terrified of that. I didn't know about deep flap or any other flap procedures for that matter before I met with the breast surgeon.
Mm.
Um, but then as soon as I found out about the risks for that, I was like, you know what? I'm pretty sure that flat is going to be the thing that I
Mm.
do. And even then, like when we were talking about it beforehand, I was like, you know what? I honestly wouldn't mind just like not having boobs anymore. And I know like that's really hard to talk about with a
Right.
spouse, but I was like, I don't want extra surgeries. I don't want all those risks. It's really scary. Um, and then when I had talked to my breast surgeon about the risks, I was like, yep, this solidifies it. I really just want to go flat.
Wow. And so did your surgeon know about aesthetic flat closure, or did you present that? Because I know some doctors didn't know a while back, like they
I
would call
got
it flat.
I got so lucky because my doctor, I always sing praises about her. Dr. Karowski, you are that woman. I love you. Um, she handed me a packet and she said, all of the options are in here. Look it over. Tell me what you think. And I read through it. I asked questions and there was flat closure and it showed the surgical incisions and everything like that. And I talked to her and I said, if I go flat, I want my incisions to look really clean.
Mhm.
Can I show you pictures of what I would expect? And she said, absolutely. And the reason I love her so much is because she never was like, are you sure? Are you
Right.
really sure? Because that's like you're gonna be depressed. She was never like you're gonna be depressed or anything like that. She
Mhm.
said, you know what you can do? And I was like, what? And she said, you can go topless in Miami if you wanted to. And I was like, yes, I could. So she was supportive from day one.
Yeah, that's good. That's really good. It makes it easier, like you go through so much and then having to make all these decisions and then you see all the side effects of everything else. I was scared to death of a deep flap because of the how long you have to be under. I don't
Yeah.
like surgery. Um, but yeah, so and I'm thankful that you made that decision. You and you talked to your husband, but ultimately he was very supportive of you, which is huge. And then to have a supportive doctor who didn't pressure you into getting a reconstruction that you knew you wouldn't be happy with.
Mm-hmm.
So tell us a little bit about how that operation and everything went for you. Did they also check any lymph nodes while they were there just to be on the safe side? What did that process look like for you?
Yeah, so when I had surgery, it was it was really quick. The best nap of my life,
Oh
to
yeah.
be honest. That anesthesia nap is fantastic. They gave me Versed, so I don't even remember going under. They
Oh
said, "Oh, you walked into the room," and I was like, "I did? I don't remember that. I have
yeah.
amnesia." Um, and then when I woke up and I looked down, I was like, "Wow, this is pretty cool." And I don't even want to know what I talked about with those post-op nurses in the like little after ICU
Yeah.
area. um, but I actually for some reason I bleed really easy.
Okay.
And this is a big misconception about flat closure. People say, "Oh, it's this quick in and out, one and done." That's not for everybody.
Right.
Um, I bled really, really bad,
Mm.
and they had to actually the next day take me back in, put me back under, and stop the bleed from getting worse.
Wow.
I had this bruise from, I don't know if you can see, from up
Yeah.
here all the way across my chest and all the way down my hip. And it was a little shocking. Um, and they promised it would go away. It did. Thank goodness. Um, but that was I remember being a little upset because I was like, man, I thought it would just be one and done, it would be fine.
Right.
But she was really reassuring. We got it under control. Um, and I at the same time had my fallopian tubes removed to
I was
reduce
going to
the
ask you
risk
that.
of that
Yeah.
cancer too.
Hmm.
So that was nothing compared to everything up here. Um, but I had between the bleeding and one of my chronic conditions that causes my blood pressure to just bottom out. I couldn't get my blood pressure back up. And that's after any surgery. I had a really hard time getting my blood pressure to stabilize.
Hmm.
So it felt like I was being babysat the whole time I was there 24/7.
Yeah.
Somebody had to make sure I went to the bathroom without passing out, made sure I can
Right.
get out of bed without passing out. It was a lot, but I wasn't surprised because I expected that out of my conditions. It is what it is.
Wow. So you had a bruise and they don't know where the bruise came from?
It was the hematoma that
Oh,
caused
so you had
it.
a
It
whole,
like the
oh,
whole hematoma, it was huge, and they cleared it out, and then the drains took care of the rest after they
right.
finally like sealed up that bleed.
Hmm.
And yeah, it was wild looking at myself. It like honestly, I know that there's people that have that moment of euphoria when they unwrap their chest and they're like, oh wow, like this is how it should look. But I was like, oh, what is this? Like this is a little scary,
Yeah.
but it looks cool, but I feel like I'm kind of gonna pass out because it's like a little gory.
Right.
But I felt like a total badass because I
Oh,
was like, I can't believe that I just went through this and
yeah.
I've got like these really big scars, but I did something that I am really proud of because I'm taking care of myself. I'm taking charge of my health.
Mhm.
And I want to be around a really long time for my children, for my husband. And yeah, it was really important to me.
Wow. So you already had your two children before this, and then you had your fallopian tubes taken out. Was that, you said that was the same day or?
Yeah, it was the same as I had it done the same time as the mastectomy. They did the double team, just got it all done, and um, that was the easiest part of the recovery was the fallopian tube removal. I had very minimal pain in my abdomen, to be honest. The worst part is the gas pain in your
Yeah,
back.
from the
Um,
yeah, from the
that
gas.
that sucks, but
Yeah,
it
it's
wasn't so
terrible.
bad.
So you still have your ovaries.
Yes.
Really?
Yes,
So
I wanted to wait until I was maybe 35, 40 years old to have my ovaries taken out.
okay.
Um, I worry about how it's going to impact my health, um, especially because of having all sorts of conditions that are worsened by hormonal shifts. I was really scared of like messing
Um,
with it. Um, but I think once I hit around 35, 40, I'm going to start thinking about having like the full hysterectomy, just get it done.
and the type BRCA1, it definitely impacts the fallopian tubes, obviously. And what about the ovaries and the uterus and everything? So
Yeah,
every
so it's all gynecologic cancers, and they actually, the current studies support that if you have your fallopian tubes removed, it can actually reduce your risk of ovarian cancer.
okay.
Because there's some findings that show that ovarian cancer might actually start in your fallopian tubes, which I thought was really interesting.
That is interesting. I haven't seen that report yet. That's interesting. Wow. So 35, 40, and that makes sense because a lot of people may not know this, but our hormones really protect our bones.
Hmm.
Does a lot for us. And so I could understand why you want to try to hold off as long as possible. Wow, that is a lot though. I'm still mesmerized about the bruise, the bruising that
It
you were
was
talking about.
wild. It was
That
so
was huge.
wild. And I'm so thankful that my husband was so supportive through everything because I I oscillated between like this is amazing and oh my goodness, what did I do? And
Mhm.
he the whole time he was, wrapping me up with the bandage, changing out the gauze pads, and like every time he would unwrap it, he'd be like, "You're so beautiful." And I'm like,
Oh,
"You're the best in the world." So it was really nice because of
that is
him.
so sweet. And okay, speaking of your husband, did you all ever have like a conversation afterwards about how it affected him? I know your kids are small. So can you just kind of talk, and maybe how even how you felt during that time that, you're a mom and you couldn't lift your kids, or, you couldn't do those things at that moment. How did you feel, and what was that like for you and your family?
So we got very lucky in that his command was really supportive and let him work from home. I mean, as much as he could,
Right.
given that he had to be the main caregiver and he was helping me constantly, all day and night. He was getting me medicine every, what was it, like 6 to 8 hours and, in rotation and all throughout the night, helped me go to the bathroom. I swear that man is a saint. I don't know how he did it. Um, I would not be surprised if it was an incredible stress in his life because he did so much.
Right.
And it was really hard not being able to hug my kids at first. But I will say that first flat hug was so incredible because, like, when I people people say that flat hugs are special, and I agree in that when you give somebody a flat hug, it's like you can feel their heart beating,
Mhm.
and it's such a special connection. And my kids, I don't even think they care that there isn't anything here to
Right,
hug. Like
right.
it's nothing that they're concerned about. It's nothing that really impacts them. They do look at my scars and they're like, "Oh, that's cool," but it doesn't. I wouldn't say that it traumatized them or anything because
Right.
they all they knew was mommy was sick for a little bit,
Mhm.
and I was afraid that my oldest son at the time would go to school and say like mommy got her boobs cut off or something,
Oh,
because
yeah.
like you
The
know
kids
how
will
like
say,
6-year-olds can be. um
kids will say stuff.
they're goofy. um so I was worried that that would happen, but they were both very good about it and very respectful of my space, and knew that like for a while there they couldn't be all up in my lap.
Right.
um but it felt like that time went by really fast, and before I knew it, it was back to normal.
Okay. So back to normal for you now as a previvor. What does that look like? Because as cancer survivors and thrivers, we're constantly having to go back to the doctor. Do you have to go? Are you just back on your regular schedule once a year, or do they have other preventative measures for you?
So
What is your
I
plan like?
I see my breast surgeon once a year because she likes to continually follow up, and she'll do exams and make sure everything's still good. And then I go back and forth between regular gynecology and gynecologic oncologist for they don't I did do a CA 125 test. They don't like to do that because
Mhm.
I had a scare where they were like, "Whoa, yours is really high. That's not normal." Um, and turns out I just have a lot of inflammation.
Can you
That's my
explain
chronic
that
illness
test?
thing.
Can you?
So it's CA 125 is a blood test that they say can help predict if you have ovarian cancer, or ovarian cancer risks. And a lot of them don't really believe it much anymore.
Yeah.
Um, and because it does do what happened to me, where you can have a big scare, um, and it just be nothing.
Right.
And so I don't really do that anymore, but I do the routine pelvic exams and the ultrasounds.
Okay.
So that's my little bit of preventative for gynecologic cancers.
Okay, so technically, okay, so you kind of on the same routine I'm on. So you go to your breast surgeon every year. That's good though, that they're staying up, staying abreast to your medical for anything to potentially pop up. So now that you've gone through all this, how has it affect you mentally? Like, do you get worried? Are you more like nervous? I know you say you have other medical issues, but do you also get a little worried, like if something new pops up or anything like that? Because I know a lot of us we get nervous with scans.
Oh, skin anxiety is
We,
awful.
yeah, if we see a little bump, we're worried that did the cancer come back. So do you have those same? Because I think sometimes when people hear Previvor, it's like, well, they didn't have cancer. It's like, no, they didn't, but they could. So do you live in those fears, kind of like, or anxieties at times?
I do sometimes. I feel like it comes in waves. There's sometimes where I get cysts. I just a bunch of different types of cysts. It's like another genetic thing that runs in my family. So I had a lump on my chest, and I get lumps like on my arms and stuff like that sometimes that I get removed. And I do panic when I get something sore in my armpit, or like if
Mhm.
I feel something on my chest, I'm like, oh my gosh, is this like one of those cysts or is it something
Right,
else? And especially with um, like pelvic health and stuff like that, I I have endometriosis, and
oh, okay,
I have pelvic congestion syndrome. So it's just a bunch of pain and inflammation, and I pretty much constantly worry about gynecologic cancers because of that, especially because I didn't do the full
right,
hysterectomy yet. But with my chest, I'm less so worried that because I can feel everything now. It's all right here. It's
Yeah.
easy. And like, I can feel down to my ribs actually. So it's like, I know what's in there.
Yeah. It's amazing because I get confused with the bones. Like sometimes
Yes.
my bone feels like a knot. I'm like, oh my God, is that
And
a knot or
my ribs are bent. So what that was the
oh
weirdest thing after surgery. I was like, why does this stick out so far down like here? And my surgeon was like, your boobs weren't small. And I was like, yeah, but like, and
wow.
she's like, if you wear tight bras, you're altering your bones. Like these are your bones that are curved a different
Oh,
way because your boobs were so heavy that it was just crushing your bones.
wow.
It was
Wow.
weird.
Oh my goodness. So now, I mean, like, so after you went through this, which to me is bold. It's a bold move. Some people won't do this because of what society may have to say, especially the fact that you went flat. I think a lot of times when I've seen some previvors, not all, but some have been, they've gotten implants or they did deep flap, or was it now Goldilocks, I think.
Yep.
But for you went straight flat. And have you had any type of regrets or anything, or thinking about maybe I should go back and get something else, or it's just been pretty much, no, I'm completely satisfied and I'm okay with how I look in my life? Because I really want people to hear that part, because it can still be 100% a very beautiful life and you're still a very beautiful person. So can you elaborate a little bit about that, as far as like just your beauty and self-identity?
So being completely honest, there are some times, especially when I see different types of clothing that I really miss wearing, like things with individual boob cups,
Yeah.
or really fancy lingerie or something. I'm like,
Mhm.
oh, that would be so nice to have boobs. But then I like collect myself and I put on a nice outfit and I remember that I'm awesome just the way that I am. And again, that sort of comes in waves and I
Right.
get over it and then I'm fine. But I honestly have never felt more confident than being flat, because I I've always had a really weird relationship with my breasts, and
Mhm.
I, especially as they grew when I was getting older, I just wanted to hide them. I don't know. I was really weird in my body, a lot of dysphoria surrounding my chest, and I now look in the mirror, and especially if I can just take my top off wherever, because like it's not illegal.
Right.
It's honestly so freeing, and it feels natural and it feels right, and I genuinely love it. And I don't even care if I have like the scars that are spreading a little bit on one side, because I definitely used this arm a little too early.
Right.
I love being flat. It's so freeing, it's so empowering, and I finally get to wear t-shirts with stuff on the front and you can see the whole thing. It's not curved under. You can
Not
see the
covered under
whole
your breath.
design.
That's hilarious. Yeah, I agree though about the confidence. I always had, even when I was really, really small, I still had body dysphoria. Like I had issues. Um, which, mental stuff, just not feeling worthy enough. But after losing my breast, honestly, was when I felt the most confident in my life. So I totally agree. It's something about it. I mean, it's not for everybody, and I understand that and I respect that, but it did, I think, just from all those years, and maybe I'm sure you can relate, all those years of having that image of yourself, and then something just switched, like, I'm
It's a
beautiful.
literal weight off of your chest.
Yeah, literally, and all
Mhm.
literally and figuratively, even mentally. And when you were talking about take it off, you're just taking it off because you can. So your picture got banned last night on TikTok, right? So
Ah!
just just throwing it out there. So it's the one with the what was it? They have
Oh,
grapefruit or
the
something.
pomelos.
Yeah, yeah, okay. I didn't know if they were grape. I didn't know. So I was like, maybe grapefruits. But they were like so I kept on reposting it because I was angry, and I was like, I kept on reposting it because I knew what they were trying to say, because all the other pictures you were flat and you could see the scars, but those you couldn't see, like, did she have breasts behind there? Is she trying to portray to be something? So I went back and forth and I kept on posting, they kept on blocking it. And I was like, forget it, I'm gonna appeal it. And so I appealed it, and they were like, I said, look, she has no breasts nor nipples, and you need to approve this.
Oh my gosh.
They were like, we are sorry about the inconvenience this may have caused. Your post is back up now.
Yay.
It's like, good, one win. But yeah, they do it all the time. I know there's some tattoo artists that, the 3D nipple
Yeah.
tattoos, they get banned all the time, and I have to repost it and I have to appeal it. But yeah, yours was the first, because I had someone else up there, and one other person, but they didn't ban, but I think it was that. I think it was
Yeah, well, I know Instagram constantly tells me to take stuff down. Like, I had posted a picture from my 30th birthday trip, and I was in just bikini bottoms laying on a deck. And I know that that was like a little sexy, but I don't have boobs. Like, why is it telling me to I don't know. The algorithm doesn't make sense
Yeah, it
sometimes.
doesn't. But
I
yeah,
have less breast tissue than my own husband. Like, it's just
right. Like, we don't even have a nipple. So then I was looking, I'm like, oh my God, y'all didn't even ban me for my picture that I have right here above her picture. And you're sitting here banning her. But I think it was the fruit.
it had to have
I
been.
think that kind of was
It was
like,
a suggestive one.
what the heck? What's she hiding behind the fruit? So when you were said, I was like, oh, wait a minute. Yeah, I did. Yeah, you got banned.
Whoopsie.
No, you're fine. So so speaking of social media, because that's how I found you. So are you like an influencer? Like, what are you doing? Because you are on social media quite often, and you have some really good creative reels and pictures. And what led you to that? Was it the confidence? Was it the activist in you? Like, what led you to social media to be an
I
influencer?
I wanted to show other young people that it's okay to go flat. Because when I looked up pictures of flat people, and this is not to say that it's bad or anything, but it was much older women in their 50s or older. And I was like, you know what? I don't see people my age. And I'd
Right.
like to see people my age and show other people that are probably in the same position as me, if not similar, that it's totally okay to do what they're doing.
Mhm.
And that we can still have a full, happy life, just looking a little bit different.
Right. That's good, because when I look at your Facebook, I see you're an advocate, obviously, for I think it what do I primarily say? I see about flat, which I thought that was good, because you're younger than me. So that encouraged me to even, like, okay, embrace this. Look at her. She's young, she's vibrant, she's up here showing her chest. She can do it. That I can do it. Like, that encouraged me. So you're right. Representation is everything, everything. The other thing that I see that you represent a lot, I think it's transgender. I see the flag a lot. So it's like, I love the fact that you speak for people, like you're advocating on behalf of people and issues in society that some people, even because a lot of people even look at us being flat and frown, especially if we take off our shirt. So thank you for doing what you do. And what, like, outside of that, now that you've been doing this for so long now, is there a message that you just want people to know even more beyond just the like, what is your message? Just tell us what your message is. I don't want to put words in your mouth. I heard you
Yeah.
say definitely about representation, but are there
Yeah, so
other messages?
definitely with representation, but also just knowing that your worth is more than what your body looks like.
Mhm.
That's really what it comes down to. Especially because I had been objectified so bad by men in my past that like it felt like I was reduced to what my bra size was.
Right.
Um, and it's sort of one of those things where I feel like I'm reclaiming my body,
Mhm.
and it's totally okay to not do what everybody else is doing just because they think it's what's best for you. Um, everybody should make their own decisions and know all of their options and be completely informed. And yeah, that was my message.
I love it. I love it. You're just so fierce in what you do. I absolutely love it. So, with that being said, was there anything else that you wanted to share also, as far as like where people can reach you or any organizations that you're part of or you want people to know about? Anything you want to share? Because, oh, wait a minute. You were was it a magazine or an organization with lingerie not too long ago?
Oh yeah, so I had done a campaign with Ana Ono. They are an incredible brand that they have mastectomy specific breast care items. So like post-surgical bras, regular bras for all chest types, flat, flap, everything. Actually, I think their most recent one is for people that only have one breast, which is
I think
incredible.
so. Yeah, I think I've seen that.
And their clothing is so comfortable. And that's not just because I modeled for them. Like, honestly, the most comfortable stuff that I put on my body, especially their pants. Oh my
Really?
gosh.
I didn't even know they sold pants.
They're
Wait, they're
so comfy.
pajama pants, right?
They're like really good for recovery. They're so comfy. Um, and so I've done that. I'm actually wearing a Breasties
Oh,
sweater
the
right now.
breasties.
I love the Breasties with my whole heart. I found them first when I found out that I had the genetic mutation,
Mhm.
and most of my education came from them.
Wow.
I I love everything that they do and everything that they stand for, and they are so inclusive and they aim to be inclusive, which makes me really happy. I've
Right.
always felt welcome. So I really love the breasties. I'm trying to think if there's anything else.
The Ana Ono is what? Okay, so they're lingerie, and
Mhm.
then the breasties. Can you tell us a little bit about that particular organization? I know they're. You said they're inclusive, but what exactly do they do? Do they give like research information or?
They do so much. So they are geared towards people in the breast and gynecologic cancer communities. They celebrate everybody from caregivers, previvors, survivors, thrivers. Everybody's welcome. And they do everything from sharing information and advocacy efforts to hosting events, which are really incredible ways to meet other breasties, as they call them.
Right.
Um, and I've met so many great people through the breastie community. They have an app as well for finding other
Oh,
people.
okay.
Um, I've met so many amazing people through that community that I can't imagine my life without at this point.
Oh, wow. So did you ever go to their camps or
I
anything?
didn't get to go to their camp, but I went to their app launch party and it was so much fun.
Really, they look like they have a lot of fun. I had three friends to go. I think it was last year. They look like they had a blast to
They
the
know
camp.
how to party in a good way.
That is so good. Are you okay? Are there any other organizations, far as especially for previvors and aesthetic flat closure, that you are a part of or that you want to recommend anyone to or
Yeah,
anything they're doing?
I would like to shout out Not Putting on a Shirt. They
Mhm.
have a resource that's really helpful for finding flat positive surgeons. Um, and it's not like anybody can just put a name on a list. They have to be
Right.
verified by the organization as somebody that has provided a positive outcome and a positive experience. So I take that pretty seriously. They
Right.
also have galleries of different types of flat closures, so you can see what might look best on your body, and have options to show your surgeon, and more educational resources too.
Awesome. Yeah, I like Not Putting on a Shirt. Kim is so sweet.
They're
She's
really great.
yeah. Okay, and is there anything that you're doing or getting ready to do or you want people to know about, or where to find you if you want people to find you on Instagram or wherever?
Yeah, so I'm on Instagram. My handle is chronic not cured, and I am most active on there than anywhere else. I'm more of a watcher on TikTok. I scroll endlessly sometimes, but occasionally post there. It's just not my, I don't do the long videos. I'm so awkward sometimes. But yeah, I post on Instagram, and I I am a loudmouth. I like to get my opinions out there about flat closure and promoting it. And I just yeah, I'm excited about continuing my advocacy. There's some goals that I would like to see out of the world that I hope that I can contribute to the efforts for.
Right.
For example, I I really hope that media becomes flat positive, and not just like, because so I'm not sure if you've heard about the show One Mississippi done by Tig Notaro, who is a comedian that's flat. Um,
Okay.
but Tig actually has a scene about her flat journey
Hmm.
that's really powerful and emotional, to be honest. I actually cried watching it. Um, and Tig's journey with cancer and everything like that is throughout the show. Um, but I also would love to see like flat joy and people that are, and I know this is like a little scandalous, but like maybe a flat sex scene in a major movie would be amazing, because like, or even just a scene where somebody is dealing with cancer or something in general, and
Right.
there is cancer and intimacy would be a big thing to talk about um on the big screen or even in shows.
Mhm.
And I would love to see more flat models, more flat actors and actresses, and not even just women, but men can have breast cancer too. And how
Right.
often, if at all, do you see a male breast cancer
That's true.
patient that has surgical scars on the big screen? You just don't.
You don't.
So I would love to see a whole wide variety of representation in media. It would be incredible.
That's powerful. You're the first person I heard say that, but you had me thinking. But that's so true, because there was a show. Gosh, I think the girl's name is Gabby. Um, and I think the show, it was not it was Empire, and she's overweight, and she had this like intimate scene, and people lost their mind. But it was like,
There needs to be that
people have sex.
representation.
I mean, like, it needs to be, because if not, it's sort of like, oh, well, only they can be beautiful or sexy, not us. So no, I totally get where you're coming from. And that's a very good yeah, I hope to see a whole bunch out there, because there's just not. I thought it was phenomenal that, who was it? Renee on The Simpsons, which they,
Yeah.
that was powerful. Now they have two other characters. So to see that was amazing. And the only reason why they couldn't do completely flat, because they wouldn't have been able to like tell. So that's why they had just one breast. But still, it's still a representation of.
Absolutely.
So no, I totally agree, especially with men, because men are just, it breaks my heart how they're not represented that much at all.
Yeah. And isn't it like Beyonce's dad had breast cancer?
Yes.
Yeah. So, like, people just don't talk about that
And
enough. Like,
actually, he has a gene. He has,
oh,
I
he
think,
does.
yeah, he has a gene. I read it in an article. So he did. So yeah. So if he has a gene, I mean, we never know who in the family may, but as you already know, that can be other family members. But yes, he did have breast cancer. So, and there's other actors as well, but you just don't hear about it a lot at
Yeah.
all.
I think Kathy Bates, I believe, is flat, but um for the most part, I don't, I never even really knew or noticed until
Right.
somebody was like, "Oh, if you want representation, there's Kathy Bates." And I'm like, I had no idea. I
Right.
The way they costume her, you could never tell.
Yep. And that's a lot of it, because of the image that society wants to portray as being beautiful. And it's so wrong. So wrong. So I love the fact that you advocate for a variety of different topics and social injustices, because it needs to be spoken about. Multiple things need to be spoken about and fought for. So you had a song. Is that everything though? Is that everything that you wanted to share? You sure? Okay. Because I want to make for sure that you share whatever you want to share. So you had a song which threw me for a loop because I'm not gonna lie. I've never, and I was young in the 90s and I was like, where did this song come from? I never even heard of this song. You're like, yeah, it's a 90s song. And I'm like, oh, I probably know it. And then I listened, I was like, I had no clue where this group even came from. So can you tell us the name of the song, the group, and why you chose the song?
Yeah, so it is Bring It All Back by S Club, who is formerly S Club 7. Unfortunately, one of their members passed away.
Oh, wow.
But they were a huge part of my childhood. I have gained so much confidence just listening to the song gets me like raring to go. I'll hear it in a grocery store still sometimes, and I'm
Really?
dancing down the aisle because it gets me hyped up. It gets me excited to be alive and to get to love myself as I am. It's just a very positive song. And if I'm ever down, it's one of those songs that just brings me right back, you know?
Yeah.
So I just love it so much.
When I heard it, I was like, okay, I can see like it's a real upbeat, up tempo song, 100%. I was like, yeah, this seems like her personality for sure. Um, so before we leave, I would like for you to share one word and the reasoning for your one word and how it can help someone else heal the wounds that they have or the scars that they see every day and they just haven't adjusted to them and they're still having a hard time because like you said, even sometimes there's certain things that you see that kind of bothers you, and I can relate to that because sometimes I'm like, dang, going, if I had breasts that would look kind of cute. So if you could speak to those individuals in a word that can kind of encourage them.
Yeah, so the word I would choose is community.
Mm,
And I encourage everybody to find their community because it makes a really big difference. And I feel like in modern times, people don't really lean on or practice community care as often
right.
as they could or should. Um, and I find that it's really important to take care of others to whichever capacity that you can. And it doesn't have to be financially, it could just be emotionally or, something like that. And to let other people take care of you in return, um, because you aren't and you don't need to be alone.
Mm, wow, that's powerful. I love it. And for you, I will say that you have just got such a genuine heart. And so when I think of you, I'm like, oh my gosh, you're just so many things. But what I see the most is you're caring. You're caring and you're caring of all people, not just some people. And that's why I want to make a point to say the different things that I've seen that you advocate for, because there needs to be more people like you who have this burning desire in their heart to want to see the world at peace, to want to see people treated fairly, to want to see people treated, equally. And I see that in you. And I just hope that as you are continue to live, that nothing in this world would just totally distract you or distort you from ever being the caring person that you are, because it's needed throughout this whole entire world so much more. And not only do you care, you actually go and you try to utilize, and you not just try, you do utilize your voice so that other people can hear the things that touch your heart and that can help other people get through their lives successfully, because so many people in the areas which you advocate for don't want to hear their voice. So even for those who can't speak, or like I always say, we speak not only for those who are alive, but even those who've transitioned. You have been that voice. And I just encourage you to continue to be that caring voice that you are.
Thank you so much. I really appreciate that. That's very kind.
Absolutely. You deserve all of it because you go
Thank
really
you.
hard.
You're the best.
I appreciate you being up here. And if you don't have anything else, then that's it. So here's another episode of Our Scars Speak. Thank you so much for coming on. And for all of you who came on tonight and watched, we encourage you to share your stories. Our scars speak. Our mental and our physical scars speak a story that need to be told. When you're supposed to tell it, I don't know, but you need to tell it. But make for sure that you have it within your heart to do so. We're not trying to force you to share your story, but when the time is right, make sure to share your story, because your scars, your mental and physical scars, speak a story that can help heal the wounds of another. And with that being said, we love you and we hope you have a good night. Bye.
Thank you.
You're
Bye.
welcome.